AM Extra wants to know, how is the surge in the Omicron variant impacting the LGBTQ plus community in Oregon? Well, to answer that, we are joined live with the CEO of the Cascade AIDS Project, Dr. Tyler Tamir. Good morning.
Morning. Thanks so much for having me.
Now, has COVID-19 impacted the LGBTQ plus community more so than the overall community, or are there specific things that are making it more dangerous?
Yeah, great question. I think sexual and gender minority populations already have a higher rate of relevant risk factors for COVID. So smoking and vaping and other comorbidities such as asthma, cardiovascular disease, diabetes, and cancer. All of those things we know correlate with complications of COVID-19. But socially, we also know that LGBTQ folks are at a greater likelihood to be working in frontline occupations such as retail and food services, and have higher rates of poverty and live in concentration of urban areas, all of which make them more likely or more susceptible to Omicron.
Of those situations, what do you think is the biggest challenge that the LGBTQ community has faced during the pandemic?
Like many of us, the economic insecurity that comes along with the pandemic has hit the LGBTQ plus community hard. But I also think it's important to highlight the social isolation of the pandemic that is caused on the most vulnerable parts of the communities we serve, especially those who identify as transgender or non-binary folks, as well as older adults in the LGBTQ plus community.
Now, we're all very familiar with the Cascade AIDS Project. You've been involved with this community for a long time. How were you able to provide some help, some services to people who are in this situation?
Yeah, we would love to have folks who are in need of our support, whether it's social services or direct healthcare, visit us at our healthcare location, Prism Health in Southeast Portland. If you're an older adult living with HIV or impacted by HIV, our Aging Well program, or by visiting one of our community partners like the Q Center, Equi Institute, or many other LGBTQ serving organizations in the community. All of those resources can be found by visiting us at capnw.org.
We hear a lot about vaccine hesitancy, especially in the African American community. What about in the LGBTQ community? Have you seen evidence of vaccine hesitancy, and is that an issue?
I think that communities that have been stigmatized and have had policies that strike at their human rights always have a higher susceptibility to have hesitation towards any vaccination. I think we've done a good job of educating the community about the current vaccine and its efficacy, and are working with our community partners to ensure that LGBTQ plus folks have access in a safe and affirming way to the vaccine.
And give us your website again so people can get in contact with you if they want to do that.
Yep, it's capnw, so capnw.org.
All right. Thank you very much, Dr. Tyler Tamir. We appreciate you joining us on AM Extra this morning.
Thanks so much for having me.
We have plenty of resources about the coronavirus pandemic, including information from the CDC and state health authorities, as well as vaccine clinic locations. So you can find that under the coronavirus tab on coin.com.